All right, I am going to start. So, Chapter 10, General Anesthetics. Identify the plane of anesthesia that the person should remain in a stage 1. There's too many people I can't. Oh, there we go. Make that red. Yep, stage 1. Signs and symptoms. They're still doing what you're asking, and their feet will point outward, indicating they're relaxed. So oversedation, like a lot of these things is the same thing. Dysphoria, fidgeting, restlessness, agitation, combative are all the same things. So I would say they get diaphoretic, which means sweaty, and they get like restless. They're restless. That's what I would call them. Like they're moving around more. So that's what I would say. So you don't have to memorize all of these words because it's all kind of saying the same thing. There. All right. Purpose of balanced anesthesia. So this is perfect right here. Giving a patient lower doses to prevent side effects. That's exactly what I'm looking for. And also when balanced anesthesia is used, and this would be like for an operation that you're getting really put under, you skip over stage 2, which is what we want. The person will get right into stage 3. Explain. I don't know. Example, Versed to lessen anxiety, opioid for analgesia, antibiotics. That comes later on, this answer. Pre-anesthetics, right? Okay. So opioids, ultra short acting barbiturates, benzos. Okay, to relieve anxiety, Versed. Versed, you could say that's what it's used for. They usually give you Versed for the amnesia properties of it, but it also is an anxiolytic. They may give you an antiemetic, which would prevent nausea. And this says to prevent analgesia. I don't think we want to prevent pain relief. I thought to provide, maybe.
So, like, when you say provide, it's like you provide a pain relief from pain.
Relief. So analgesia means pain relief.
Oh, okay.
Right? So pain relief. So to provide relief of pain.
Sense.
Okay. So you might get some opioids to prevent infection, antibiotics. Good. That's what me. Anti-infectives are a general umbrella term for antibiotics, antivirals, antifungals. So we'll talk about those in a couple of weeks. Paralytics are things that they give you to paralyze basically your chest muscle so they can intubate you. Yep. So if a person enters stage 4, yep, they could die, and most surgery is performed at stage 3. Most popular inhalation anesthetic used in dentistry is nitrous. May it be used? Yes. Why would you combine nitrous with another inhalation anesthetic during surgery? So that also happens in the hospital, and it goes back to the same reason about balanced anesthesia, that you can give lower doses of a potent inhalation anesthetic and nitrous. It prevents side effects.
Is that when they put with the oxygen?
That's different. So they combine nitrous and oxygen together always, always, to give someone a light sedative, like sleepy feeling. But you couldn't perform surgery with a light sleepy feeling. So they would give you potentially a very strong inhalation anesthetic in conjunction with some nitrous.
So the main reason is to reduce the side
effects,
not to put them in stage 3?
Correct. It is to reduce the side effects.
And And we're talking about stage 1. Or we're
I'm talking about surgery in a hospital. So in a hospital setting, they have nitrous also that they can give you. So instead of giving you, and I'm making up this number, I don't know what it is, 10 milligrams of the inhalation anesthetic, maybe they can give you 7 if they combine it with nitrous. And they always give nitrous. You always also have to have oxygen. Okay? All right, so these were a lot. So indications, I would say, is pretty much anything. Like an indication for nitrous, the patient wants it, they're fearful, they're a child, it's reasonably safe. I would focus my mind on who would you resist giving it to or shouldn't have it? Someone with mental illness, someone like with a really bad cold, if they're pregnant. So those are the things that I would avoid using, or they don't want it, right? Some people don't like that feeling of the hood coming over their nose because they're basically sort of tied to the chair at that point. So it can make people feel panicked. And that's why claustrophobia, people that are afraid of enclosed spaces, they don't like it. And then if they don't want it, then, they don't have to have it. Yeah. So that might be a benefit. So if this will happen to you in your practice, you will work on someone that's extremely anxious and they're jumping constantly and you've got really sharp instruments in there and it makes people very anxious. Like you will be sweating. So if you can give them just like a small little dose of nitrous and they just calm down, then everybody calms down. All right. You will be relaxed. And the most important person to be relaxed is me at all times. Because they can't breathe it in. It goes over their nose. If they have a bad cold, they can't breathe it in.
They tried on my son. He was not relaxed.
Huh? Son, he didn't like it.
He was not relaxed at all.
There's a claustrophobic feeling that can come over someone. All right, so universal colors of the tanks, nitrous is blue, oxygen is green. And they've even now made sure the tubing is the same color and the clamps. They really want to make sure that you are not giving someone a whole bunch of nitrous by accident. So the scavenger system. So I liked these answers, but I guess another thing that I would want to know is who benefits from the scavenger system? The clinician, right? The scavenger system is in place to suck up the excess gases. Oh, thank you. Who's ever writing that? Dumbo Octopus. It's to benefit the clinician so that you are not being chronically exposed every day, every patient to nitrous. Okay. So we have oxygen, always given in conjunction with nitrous. What is tidal volume? So it's the volume of gas inhaled and exhaled during one respiration cycle, but they do it per minute when they're talking about like nitrous. So it's about 5 to 8 liters per minute or 500 milliliters per. You don't have to know those numbers, right? But maybe how do you know that it's too much after you've put it on the person? What does the person report? Yeah, it's blowing up my nose, right? If they say they can't feel it at all, that's when you crank it up a little bit. So you begin to add nitrous. You always lessen the oxygen to keep the tidal volume the same. And so that's good. For dental hygiene concentration, we are keeping it at the 35 nitrous, 65 oxygen. When you start going up to 50-50, 65, 35, that's when you risk someone entering stage 2. So you don't want to do that. The general anesthetic, IV, intravenous general anesthetic useful in children is ketamine. Major disadvantage to IV opioid administration is prolonged respiratory depression. Correct. Most commonly used IV general anesthetic is propofol. Chronic exposure to nitrous may result in two side effects: peripheral neuropathy, which is tingling in the tips of the fingers and the toes, but usually the fingers, and also spontaneous abortion, which is miscarriage in women who work with nitrous and in males who work with nitrous, and in pregnant women that don't work with nitrous. So I like that. In who? Everyone. Good. Every person. All right, so that's GA. Cardiovascular. Prototype drug for congestive heart failure is digoxin. Not used very often anymore. And I think maybe down here somewhere there's something. I'm going to go back. Yes, it is. Okay. So differentiate between ionotropic and chronotropic. So negative chronotropic reduces the heart rate. That's like a whole lot of words. You could just put reduce, like negative is reduce heart rate, positive is increase heart rate. Ionotropic has to do with how hard the heart muscle itself, the myocardium, squeezes. So it either squeezes more or squeezes less. So if it squeezed more, do you think that would be a positive ionotropic or a negative? Positive. So dental-related side effect of digoxin is increased salivation. So that's definitely going to be on the exam because very few drugs cause an increase in salivation, and this is like a drooling, just running out of their mouth. All right, drugs used for the treatment of angina. So nitroglycerin, severe headache. So if I say nitroglycerin gives you a severe headache, do you think that it dilates all of your blood vessels or your coronary arteries?
All of them.
All of them. Good. Calcium channel blocker. So this isn't correct because even though orthostatic hypotension is true, calcium channel blockers are used. Yeah, they use more often. Does anyone remember the drug that's always combined with nitroglycerin? If people take that as needed, they always have to take. Yep, beta-1 blockers. They'll also be taking atenolol or metoprolol. But the calcium channel blocker is useful for angina because it does both of the things that the other two drugs do. But it's gingival hyperplasia there that we're looking for with the calcium channel blocker. And you have to memorize the names of the calcium channel blockers. All right, so I'm going to...
So in the study guide, there are 3 listed, but in the handouts, there are 4.
There are?
I don't have one.
What do you mean? Side effects related to calcium channel blockers?
Yeah.
What is it? Huh? Okay. Well, if I don't know it, it's not going to be on the exam. How about that, right? If I don't know it, I'm sure. I mean, every drug, you're going to get nausea, vomiting, diarrhea, dry mouth, orthostatic hypotension. But like the one with calcium channel blockers, I want you to know the drugs' names and that gingival hyperplasia is the side effect. All right. Drug group not to be used with nitro products. The phosphodiesterase inhibitors, sildenafil, and all of those. Cause of death. What is the cause of death?
4.
You combine, right? So what kind of contraindication is Viagra and nitroglycerin? Absolute contraindication. What's the cause of death?
Vasodilation, significant vasodilation.
What kills you? Cardiac arrest. The reflex tachycardia the heart will get out of sequence, right? You'll probably end up with a ventricular, fibrillation, and then a cardiac arrest. All right, most common cardiovascular disease, hypertension, most common agent, thiazide diuretics, specifically HCTZ, hydrochlorothiazide. People aren't trying to get in here, right? They're not in the door. Okay. Rhabdomyolysis, again, very, 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 very rare, right? That does not happen. It actually means muscle melting, and that's what happens. Little old ladies are going to benefit from those thiazide diuretics. Which drugs interact with the most diuretics? NSAIDs and aspirin. Good. So suffix for ACE inhibitors, Pril. Most serious side effects, angioedema. Most annoying, the cough. Safe for pregnant women? No. Where do they work in the RAA chain? Lungs, by inhibiting the angiotensin converting enzyme. Should you combine them with NSAIDs? Why or why not? Short term, it's fine. Long term, no. So short term is fine, meaning like you just did a deep scaling and the patient's like, I'm so sore. They can take ibuprofen for a few days. It's not going to kill them.
So the breakdown of muscle fibers, I'm sorry, I'm going back.
Yep, to the statins, yep.
So that is related to statins.
It's related to statins, yep.
And not hypertension.
No.
Okay.
So it's related to cholesterol lowering agents. What is it? HMG co-reductase inhibitor. All right. Suffix for beta blockers, alol. Which type would you limit? Epinephrine, the non-selective, and recognize the name of selective versus non-selective. Good. Most significant dental side effect of the calcium channel blockers is gingival enlargement. That's the most significant. So see how we have those 3 drugs listed there? Would you be able to identify amlodipine as a calcium channel blocker?
Yeah.
Because dipine is the suffix of the calcium channel blockers. For the majority of the calcium channel blockers, they end in dipine, except for these other 2. That's why you... Yep. It's like cardizem and something else. And knock acid, I'm going to use both names of the drugs. The only time I don't use both names of the drugs is when I think you're going to know when I say Narcan. I don't think you should need to know what the generic is there. So in that instance, I might just use that name. All right. Yes, they are at risk for xerostomia because of diuresis. Cardiac condition, lidocaine's used for is an arrhythmia, and how would that be administered?
IV.
Yeah. Yep. IV. So LDLs, and again, like this is very general. There's new studies saying LDLs are not as bad for you as they once thought. But in general, LDLs are considered the bad, HDLs are considered the good. And we are trying with the statin therapy and the other drugs that they use to lower cholesterol to lower LDLs and the triglycerides. All right, suffix of most commonly prescribed cholesterol lowering drug is statin. Most significant drug interactions with warfarin. Most common side effect. Right, so someone had answered rhabdomyolysis. It's muscle pain. Patients will report muscle pain, but they actually cannot differentiate now. Is it because the person's just old and that's why their muscles hurt? Or is it actually from the statin?
And what does it mean, interaction with warfarin?
So warfarin is just very, you could end up bleeding more. It can break some of them off their protein plasma binding sites. And in fact, like if you see a question on the national board that asks you about a drug interaction, warfarin, it's almost always warfarin because it interacts with just about everything. Not like super deadly, like warfarin and aspirin, like warfarin and Tylenol. There's something going on there, not exactly the same as aspirin. Aspirin's the worst with warfarin. All right, Let's see. Describe the difficulty with dosing anticoagulants. Because if you give too much, they'll hemorrhage. If you don't give enough, it says danger of embolism. What's the other thing? Thrombus. Yep. And most significant drug interaction is aspirin. All right. Sedative, calming, hypnotic. I would just put sleep there. Anxiolytic reduces anxiety. Just getting rid of as many words as I can. Analgesia is pain relief. Yep, I spelled it wrong. All right, pain relief. Tardive dyskinesia, uncontrolled movements. And so then this is good. It involves mostly the mouth, neck, and also the hands. So 2 suffixes for benzos is lam pam. Why are they? What? Oh. Okay. I'm doing my best here. Am I don't know. There's like a half a dozen of us trying to change this. Red. Okay, good. 2 reasons they're preferred over barbiturates. They have a wider therapeutic index and they're less addictive. The 3 reasons people may have seizures: local anesthesia overdose, status epilepticus, and alcohol withdrawal. Barbiturates are no longer prescribed for anxiety. I'm going to say they replace GABA. If stopped abruptly, the brain cannot produce sufficient GABA, and then a seizure may result. Do sedatives provide analgesia? No. All right, Haldol and Thorazine are conventional. They have more side effects. Good. Did I ask you about their potency? Does it matter? No. They are just conventional, indicating most likely they'll have more side effects. And the effect that is most significant is that EPS, extrapyramidal symptoms or extrapyramidal side effects, which underneath that umbrella, tardive dyskinesia is one of them. Make that red. All right, we're getting there. So compazine is used for nausea. 3 oral side effects seen with antipsychotics: tardive dyskinesia, xerostomia, bruxism. That's good. Recognize the name Prozac. So if I say Prozac, I might just say Prozac on the exam, not fluoxetine. But if you want me to say fluoxetine, I can. But most people recognize Prozac as some sort of antidepressant. Most common side effect, GI upset. In fact, they will continue to up your Prozac until you have nausea, vomiting, and diarrhea because you have most of your serotonin in your gut. So that's how they actually determine the right dose for you until you're throwing up. Oral side effect, bruxism, xerostomia. Significance of bupropion is help with smoke.
So we should be putting that off in order to know that this is the right dose.
What? I can't hear you.
So we should be throwing up with this medicine in order to know.
You should be pretty nauseated. Once you're having nausea and diarrhea, they think, okay, that's the right dose. Then they might back it off a little bit. It means that you're releasing enough serotonin in your gut, so they think you're releasing enough in your brain, although all of that has been disproven. So I don't know. I'm just going by the book. They don't understand the brain. Bupropion, yes, it helps with smoking cessation. Why might you not be talking about it, though? Yeah, it's a black box drug, okay? All right, drugs for mania, lithium. The biggest one with lithium is a metallic taste, which drives people crazy. It's like they're chewing on tin foil. Most of the time, people take other things like the valproates, like Depakote, Tegretol. Does anyone remember from Unit 3? What is the side effect with those that we're worried about?
So dysphagia.
Right, and how would that be evidence to you? bleeding, but what also might you observe intraorally?
Oh,
Petechia?
they don't heal well.
Yeah, but petechia. What's the next one up?
Purpura.
Purpura. What's the last one?
Echymus.
Ecchymosis. Ecchymosis. Yeah. Let's tie a little bit of oral path in here.
Are you gonna ask which anticonvulsion medication is used for mania again? Like it could be any of those.
Yep. Yep. You got to know lithium.
Well, I know lithium, but then valproate and then the other ones
Tegretol.
are equally used.
They're used actually more often. So that's knowledge for yourself. It's really not knowledge for the exam. Lithium is not well used. People gained a ton of weight. They hated all the side effects. Their mouth tasted terrible, tasted like metal. You can't exercise when you're taking it. But it is very effective in treating mania. But they might try other drugs that have fewer side effects. It might be not as effective, but effective enough in the real world. But yeah, you got to know those ones. So lithium, metallic taste. If I ask you something else, bleeding.
Lithium cause bleeding?
No, metallic taste. All right, analgesics. Site of action, mechanism of action. So opioids work in the brain, non-opioids work in the periphery. Opioids depress the brain, non-opioids inhibit COX-1 and 2. So people wanted to keep telling me pain. So I don't care about, I get it, pain. But all that stuff about sensitizing nerve endings, that's all related to pain. What are the good things that they do? Mucus in your stomach and increased blood flow to the kidney. Those are the good things the prostaglandins do. So that's interesting. I didn't know it participated in memory and other functions, which is good for me. I like to hear that. But that's not, we don't need to know that. Aspirin readily absorbed in the stomach because it is an acidic drug in an acidic medium. So here, more unionized molecules are formed. So, and you'll have to know this for local, and maybe I might ask you. So if I said to you, there are a lot of women in this room, what can you assume from that statement? There are a lot of women, so there's not a lot of men, okay? A lot of women. So when you say a lot of non-ionized, another way you can say that is not a lot of ionized. That's the same thing. No, make nothing.
I don't get it.
Okay. So when aspirin, the acidic drug, enters the acidic medium, mostly non-ionized are formed, HA. But if I said to you, not a lot of ionized or charged molecules are formed, that means that a lot of non-ionized have been formed. So we'll get like 80% non-ionized, 20% ionized, which is what we're looking for. So we can say the positive thing, we get a lot of non-ionized, the 80%, or I could also phrase it, we don't get a lot of ionized, the 20%. It means the same thing.
Thank you for being specific on that because I may overthink it.
Right. But the thing is, like, if that doesn't make any sense to you, right, I don't want you to dig deep and study that for 5 hours because that will be one question worth 1.72% of the grade. So you got to spread it out because you have to know, like, a lot of drugs on this one. All right.
How many questions are there?
Currently, I think there's 57, but I'll fool around with it until the night before the exam. That's just how I do it. All right, pharmacological effects of aspirin, how are they the same? How are they different? I love this grid, and I actually added these things that in blue that Lynn Flanagan wrote. So know these. How are they the same? How are they different? It was on the exam, the little fake quiz that I gave you the other day. How are they the same? What conditions are aspirin and NSAIDs contraindicated? So this bottom one about cardiovascular disease is true, but more aligned with the selective COX drugs like the Bextra and Vioxx. So I know someone spent a lot of time doing this, and I am going to do this. Okay. Right. And true, elderly patients are at higher risk. I'm not going to get into that. These are the things where you shouldn't be taking aspirins and NSAIDs. Pregnancy, if you're hypersensitive or allergic, and asthma is also another contraindication for aspirin. Right, combined with high blood pressure meds, but I'm going to say here long term, right? That's the difference. You can do it for a couple of weeks. It's probably not going to kill somebody. All right. What is Reye's syndrome? How is it related to aspirin? Okay, so Reye's syndrome is a brain swelling, right? So thank you for encephalopathy and hepatotox. It's brain swelling that kills children, especially when you combine aspirin and the child has a virus. No, they usually die from the brain. But even now, children don't take this. It's well known. They don't understand why it happens, though.
But you can take ibuprofen.
You can. It's aspirin.
Is it because of
They don't know why it happens. And it's very specific. It's like chicken pox, which most kids don't get anymore, right? It's chicken pox and then influenza, which all kids get all the time.
Last thing you said viral, it can be any viral or
What?
chicken.
I can't hear you.
Can it be any viral infection or only chicken pox?
I don't know the answer to that. I just know that aspirin in children under the age of 18 is an absolute contraindication. Because I don't know, could it be influenza? What if it's COVID-19? Is the book up to date with COVID-19? I don't know. Do you know what I mean? Coxsackie 6, right? Hand, foot, and mouth. Kids are always getting germs. I don't know. I wouldn't you don't give children aspirin. That's it. Right? Because you don't want to be the first case where they're like, oh, COVID-19 and aspirin leads to Reye's syndrome. Right? Right. No. All right. Is it safe? No. Fatal hemorrhage may result. I am going to shorten this a little bit because I like fatal hemorrhage may result, and it does have to do with the distribution, the pharmacokinetics distribution part where Coumadin attaches to plasma protein binding sites and aspirin kicks it off. So let me shorten this up a little bit. Okay, it can displace. Aspirin is administered. You can displace the warfarin, increasing. Okay. There. All right. Dangerous to combine acetaminophen with which drug? Alcohol. All right. And dangerous to combine acetaminophen with anything to do with the liver. So if you see HEPA, that means liver, hepatitis, hepatotoxicity, liver cancer. All right. Drug of choice for acute attack of gout, colchicine. Fever reduction in children, acetaminophen. Drug of choice for dental pain, ibuprofen. When provided a name, identify as a drug as non-opioid or opioid. So this is good, but aspirin, ibuprofen, Tylenol, non-opioid, not addictive, right? Those three things. And I will say acetaminophen, Tylenol. But you have to know Tylenol is also APAP, Tylenol is also, aspirin is ASA, salicylate, all those different names. And then the opioids, anything that you associate with addiction, morphine, codeine, Vicodin, OxyContin. I would add here, even though it is not, I'm going to add it, even though it's a Schedule 1 drug, is heroin, right? Because if someone has a substance use disorder with heroin, can they have morphine?
Yes.
Sometimes. If they're dying, yes. Any other time, no, right? Because you're going to send that person right back into the substance use disorder cycle. All right. So with addiction, they will still always have meiosis, those pinpoint pupils, and constipation. So if the person reports they were itchy, most of the time that does not indicate they're allergic. If they indicate swelling in the airway and their tongue, that indicates allergy. Itching only with opioids is related to histamine release. Da-da. Prototype opioid, morphine. So how would you use that in a sentence? Codeine is 100 times less potent than morphine. Fentanyl is 100 times more potent than morphine. They compare usually potencies to this other agent. The prototype. Classic sign of an opioid addict meiosis. Mechanism of death, respiratory depression and arrest. Drug of choice for opioid, mixed opioid, Narcan. Drug of choice for dental pain, ibuprofen. Is that it?
Yeah. Professor, so why are we talking about lidocaine and arrhythmia? Like, when was that?
Cardiac 1 that you did on your own. It was under the, you had to do, what is it, anticoagulants, cholesterol, and I believe the arrhythmias were part of that. Yeah. Any other questions? You have to know that the suffix is depine, but you have to know the other two that don't match up with that.
Okay, and then the depine and the few that are not.
Two others. Yep.
And Professor, so